So cancer in men, why are we talking about men? Why aren't we talking about women? Women suffer from cancer as much as men do to some degree. Well, largely because that's just a big part of my practice, seeing men with different types of diseases, particularly different types of cancers, prostate cancer being the primary type. But the other part is because men are just simply more stubborn. We know that across the board, women live longer, compared to all over the world, regardless of demographics, social economics, or anything like that. Women just live longer. Women also have less cancer than men, and women live longer with cancer than men do. So having a conversation a couple of days ago with a good friend. He's an internal medicine doctor, Steve Lamb. He sees mostly men. And I said, look, I'm going to give this TED talk. Why do you think that's the case? Why do you think women live longer? He said, well, let me give you an example. Women brings their husband, drags him into the office for a regular checkup. He has a spear through his head. And I let him know, how did you get that spear through your head? He said, that the patient would say, what spear? And then I said, well, no, really, why is it? Why is it that, is it hormonal? Is it behavior? What is it? He says, men have balls, women don't. So we can talk about what that really means in multiple ways, but it is very interesting really to treat men as opposed to women, and dynamics is always very, very different, as you can imagine. I like to start with perspective. Perspective, what do I mean by that? There's a lot of things in medicine that you cannot quantify. So although we always want to look at the scientific research, randomized trials showing that this worked versus placebo, and there are things that are just not quantifiable. It was Albert Einstein, arguably probably one of the greatest scientists in the world, who said, everything that counts can't be counted, and everything that can be counted doesn't always count. So perspective. What role does that play biochemically in our patients? There was one study that looked at over 330 men. 330 men who had a variety of diseases. They all had pretty much the same thing, either arthritis, hypertension, high cholesterol, things like that. And those that thought that their health was excellent were 4 times more likely to live longer than those who thought their health was very poor. All right? Another study, they looked at a group of patients, and they had pictures of different doctors and their attire. So one doctor was with white coat, the other doctor was with a suit, and the other doctor were in scrubs. And they asked them, which one would you pick, which one would you go to? 52% of the subjects chose the doctor with the white coat. They found them more trustworthy, more knowledgeable. So at risk of you not finding my presentation knowledgeable, I will instantaneously become more credible to you just by putting on my white coat. All right. There you go. I know Halloween is a week away, but no, this is perspective. I'm reminded of a patient that I had when I first started working with men. By the way, I'm a naturopathic doctor, also known as a holistic doctor. That's not the right term. Naturopathic doctor is the right term. Unfortunately, it's also known as a quack and a charlatan. But no, naturopathic medicine really plays a big role, and we look at things a little bit differently. I'm going to discuss that in a second. But it reminds me of a patient that I saw early on. He was 67 years old. We'll call him Mr. Smith. He had a recurrence of his prostate cancer. What that means is that he had it surgically treated in this particular case, and his cancer came back, and it came back pretty aggressively. I saw him in 2006. He had surgery in 2005. PSA, which is a marker for prostate cancer, kept going up really steeply. He was treated with hormone therapy, then radiation, pretty much everything else. Now he was going to undergo chemo. He comes in, very strong personality, Italian New Yorker. He says, I'm here for you to help me. I was like, okay. I don't really trust that these natural things work. I don't even trust that conventional works. I think you guys all suck. And I said, okay, let's talk. Well, clearly he was very upset about his situation. He thought, well, once I had a surgery, that's it. You know, I'm home free. And then it came back. And then once the radiation, that's it. And it came back. And then once they therapeutically treated him with hormone therapy, he thought that was it. Now he's up to his 4th treatment. So now he's seeing me. I said, well, typically a good question that I ask is, I want to know what motivates my patients to do better, to do some of the lifestyle things that I recommend. So I asked him, I said, so why do you want to do this? I'm going to give you all the hows, but why? Why do you want to do natural therapies, lifestyle interventions? He says, I saw him in November of 2006. He says, you want to know the truth, Doc? My daughter is getting married in July, and I want to be there for her. I want to walk her down the aisle. I said, well, that's a tremendous reason. That gives you purpose. And purpose is something that's also unquantifiable. So I was having a conversation with someone earlier today on purpose, on working. I recommend my patients not to stop working. Not to stop working, to have purpose, if they enjoy what they do, of course. 50% of the men sitting here today will develop prostate cancer or some sort of cancer within their lifetime. So all the men that are sitting in this audience, either you've had cancer or you will have cancer within your lifetime. At least 50% of you will. 1 out of every 2. Cancers that are more prominent in men are clearly prostate cancer, but bladder cancer is also more significant in men. I can tell you that 30% of risk related to cancer is shaved off by just stopping the habits of smoking. Smoking is a major killer. 30% can be significantly reduced, not only as it is associated with lung cancer, but also as it is associated with bladder cancer. How does that compare with women? Well, women are doing a little bit better. 30% of women, 1 out of every 3, will develop some sort of cancer within their lifetime. Very interestingly, about 21,000 men will die from cancer more than women. So men are diagnosed more frequently, and they will die more frequently from a cancer. Why is that? It probably has to do with a little bit of the stubbornness of men, that they try to avoid us at all costs. We bring about certain vulnerabilities that they don't want to face, like the finger exam, right? But what I want to suggest is, that everything I'm talking about today has to do with prevention of cancer and also with the co-management of cancer. So if we go for general screenings, particularly if you have a very strong family history of cancer, then it's prudent to go for screenings just to make sure that if there is a cancer, it's caught early. And if there's not, then you can do lifestyle modifications that we'll discuss to decrease the chances of developing it. But not going to see doctors because you're fearful. I had a 62-year-old patient for the first time last week who came to see me who've never been to a doctor before. So in his case, it's all right. He's doing great. Now he hopefully will do better. But you cannot avoid, or you should not avoid screenings and just general checkups. It can be life-saving. Some definitions. Natural medicine or naturopathic medicine, it uses natural therapeutic methods and substances to encourage the person's inherent self-healing process. Okay? What natural medicine does is works with the whole person. It stimulates immune cells. It decreases inflammatory markers. It helps the person, not just the disease. Integrative medicine, which is what I'm about, is the proper combination of natural medicine and conventional therapies. Holistic medicine is the type of integrative medicine where the whole person is emphasized. So there's a little bit of overlap here. Clearly, those that practice integrative medicine or naturopathic medicine also practice holistic medicine. You see, because I never ever seen a prostate come into my office and say, "Hi, how you doing? I have cancer. This guy right here is my owner." Right? It's always a person with prostate cancer. It's always, the prostate is not just walking around by itself. So I really believe that Cancer is a systemic disease. It's not a local disease. When you try to treat cancer locally, that's marginally effective. When you try to treat it integratively, holistically, that takes care of the person. Telomeres. These are part of your genes. That's a chromosome. The end of each telomere, the pink there, that's a telomere. The whole picture here is a chromosome. What studies shows is that those that have shorter telomeres, they're analogous more or less to the plastic parts of your shoelaces. The shorter the telomeres, the higher the association with cancer. The longer the telomeres, the least likely reduces the risk of all kinds of cancers, including prostate cancer, bladder cancer, and even breast cancer in women. So longer is better. Great study here. The left side part of the slide here is a pre-intervention. This is a heat lamp, that shows the genes of people, of patients. The red signifies cancer. The green signifies no cancer. This is a pre-intervention trial. Pre-intervention, they took a group of prostate cancer patients that had low-grade disease. They put them on a lifestyle program versus a control group who did nothing other than come back for testing. What it showed was the pre-intervention, you see all the red, after 3 months, look what happened. There were more green. Cancer cells were actually turned off after 3 months. A recent study showed 5 years later that, again, this is the same result. 5 years later shows that, again, there's longer telomeres and cancer cells being turned off in the lifestyle intervention group. What was the lifestyle? Plant-based diet, yoga, exercise 6 times a week, and stress management, primarily. CaPLESS living. This picture is not because I'm narcissistic in any way. This picture is just because it's the best picture I have from a retreat that I direct and run once a year for men dealing with prostate cancer. But we have men coming from different types of the world, different cancers. The CaPLESS method is CaPLESS is an acronym. CAP, carcinoma of the prostate, less lifestyle exercise, smart supplementation program, is implementing the science of lifestyle living for the prevention or the co-management of cancer. That's what this is about. Making it sustainable. A lot of the diets out there for cancer are just not sustainable. Drinking 25 fresh squeezed juices a day with 12 coffee enemas and things like that is just not sustainable. So this is a sustainable program that seems to work very well with cancer patients. Part of the retreat is we have cooking classes. This is one of the foods that were developed by our natural gourmet chef, Marty Wilson. What do we have here? This is exactly how a plate should look. So a quick rule of thumb, different colors. You want to eat different colors and less whites. More colors, less whites. Okay? So here we have salmon, not overly cooked, poached salmon with a nice pesto sauce. Okay? Here we have a Moroccan salad. It's quinoa with pomegranate seeds, and then we have a kale salad with sunflower seeds. Delicious. You're not being deprived. You're eating really good food. It's going to make you feel really good. Less whites, less refined sugars, less refined carbohydrates. Those promote cancer. Dietary supplements, very controversial, very controversial. A lot of misinformation. And a lot of those that are criticizing dietary supplements is because they don't know about dietary supplements. Long end of it is this, vitamin D, at least vitamin D. A plethora of research is indicating that vitamin D deficiency is perhaps increases the risk of cancers, of multiple cancers, including colon cancer, prostate cancer, and breast cancer. So at least vitamin D can be helpful. Others are helpful as well, potentially, but this is where we need more research in dietary supplements. Exercise. Here's the rule. As a naturopathic doctor, I want to provide the best dosage of natural medicine for my patients. Provide the best dosage. Exercise. You want to. Here's what I've concluded. It's 33 hours a week of moderate intensity. That gives you the best chances of prevention, and even if you have cancer, that will give you the best chances of longevity and keep the cancer at bay, because there's a whole insulin effect that we probably don't have time to go to. So it's 3 hours a week, moderate intensity, not just on a treadmill watching CNN about the government shutdown at a very slow pace. Okay? Turmeric, herbal medicine, turmeric, curcumin seems to be protective. It has anti-cancer properties. It has anti-inflammatory properties. My vision for healthcare, particularly as it relates to men, maybe for everyone, is how can we team up? Conventional doctors, medical doctors, how can we team up? It reminds me when I was a kid, right, watching wrestling. I was big into wrestling, and I used to love the Road Warriors. They beat everybody. In fact, they're the '1 tag team champions of the world historically, right? So you have the tumor inside of the ring, and then you have the medical doctor beating up the tumor, right? And all of a sudden, you know, the tumor kind of gets stronger, and it kind of gets up and starts beating up the doctor, and the doctor's trying to get to the natural doctor, right? And they tag in, and then the natural doctor comes in and it beats them up. And then when the ref is not looking, we both come in, and we kind of, right, kick the tumor out, right? That's kind of what I visualize. Here's the take-home message. Number one, you have some control. Your genes are not your fate. You have control. Just do some of the right things. Eat a lot of plant foods. Eat less refined carbohydrates. And exercise. Exercise with moderate intensity. Sweat. Get your heart rate up. Oh, yeah, and about Mr. Smith. He made it. He made it to his daughter's wedding in July, but he succumbed to his disease in November. So he did pass. His daughter told me the story, and she says, you know, I really think it was the chemotherapy. It just, you know, it was the chemo. She was blaming conventional medicine. I'm saying, no, it's just, it wasn't that. There's no proof of that. Maybe we could have been there earlier. Maybe we could have double-teamed, you know, to get rid of this cancer earlier. There's a lot of maybes, but it's all theories. Look, at the end of the day, what I like to see is the oncologist, urologist, natural doctor together, or any combination in the middle of the ring with the hands up, right, combating cancer as tag team world champion of the world. Thank you.